Colorado CNA Practice Test 2026 Certified Nursing Assistant Exam Questions and Answers. Question 1. A nursing assistant should wear gloves when: Option A. Brushing a resident's teeth. Option B. Giving perineal care to a resident. Option C. Helping a resident walk. Option D. Answering a resident's telephone. The correct answer is Option B. Giving perineal care to a resident. Question 2. How can a nursing assistant assist residents with normal changes of aging related to the urinary system? Option A. Restrict fluids so the resident urinated less. Option B. Offer frequent trips to the bathroom. Option C. Suggest the resident use a catheter instead. Option D. Tell the resident to hold their urine longer to strengthen the bladder. The correct answer is Option B. Offer frequent trips to the bathroom. Question 3. How can a nursing assistant help residents with their spiritual needs? Option A. Encourage them to join the NA's own religion. Option B. Learn about the resident's beliefs and listen carefully. Option C. Tell the resident that spiritual needs are not important. Option D. Invite a priest even if the resident is not religious. The correct answer is Option B. Learn about the resident's beliefs and listen carefully. Question 4. What is one way a nursing assistant can promote a resident's independence? Option A. Doing everything for the resident to save time. Option B. Allowing a resident to do a task by himself no matter how long it takes. Option C. Deciding what clothes the resident will wear every day. Option D. Restricting the resident to their room. The correct answer is Option B. Allowing a resident to do a task by himself no matter how long it takes. Question 5. When a resident has left-sided weakness, which sleeve should be put on first when dressing? Option A. The right sleeve. Option B. The left sleeve. Option C. Both at the same time. Option D. The sleeve the NA prefers. The correct answer is Option B. The left sleeve. Question 6. What is the term for a device that replaces a missing body part? Option A. Haploid. Option B. Prosthesis. Option C. Cast. Option D. Orthotic. The correct answer is Option B. Prosthesis. Question 7. After an amputation, a resident may experience phantom sensation. Phantom sensation is: Option A. The belief that the limb will grow back. Option B. Pain or sensation caused by remaining nerve endings. Option C. A hallucination caused by medication. Option D. The ability to move the prosthetic limb with the mind. The correct answer is Option B. Pain or sensation caused by remaining nerve endings. Question 8. When assisting a resident with a standard bedpan, where should the wider end be placed? Option A. In alignment with the resident's buttocks. Option B. Toward the foot of the bed. Option C. Under the resident's knees. Option D. It does not matter which way it faces. The correct answer is Option A. In alignment with the resident's buttocks. Question 9. Which of the following is a requirement of the Omnibus Budget Reconciliation Act (OBRA)? Option A. NAs must have at least 50 hours of training. Option B. NAs must have at least 75 hours of training. Option C. NAs must be at least 21 years old. Option D. NAs must be able to prescribe medication. The correct answer is Option B. NAs must have at least 75 hours of training. Question 10. What does the chain of command do? Option A. Lists the residents in order of their needs. Option B. Describes the line of authority in a facility. Option C. Describes the physical layout of the building. Option D. Lists the medications a resident must take. The correct answer is Option B. Describes the line of authority in a facility. Question 11. Generally, the last sense to leave a dying person is the sense of option A, thought, option B, aced, option C, smell, option D, hear. The correct answer is option D, hear. Question 12. Maintaining equal intake and output is known as option A, metabolism, option B, fluid balance, option C, homeostasis, option D, circulation. The correct answer is option B, fluid balance. Question 13. How should a fracture pan be positioned? Option A, with the handle toward the head of the bed. Option B, with the handle toward the foot of the bed. Option C, sideways across the resident's hips. Option D, the handle should be removed before use. The correct answer is option B, with the handle toward the foot of the bed. Question 14. What is a task that is outside the scope of practice for a nursing assistant in A? Option A, measuring vital signs. Option B, helping a resident get dressed. Option C, inserting tubes into a resident's body. Option D, ambulating a resident with a walker. The correct answer is option C, inserting tubes into a resident's body. Question 15. In which of the following procedures must a nursing assistant always wear gloves? Option A, brushing a resident's hair. Option B, shaving a resident. Option C, taking a resident's pulse. Option D, feeding a resident. The correct answer is option B, shaving a resident. Question 16. When should sheets be changed? Option A, once every 7 days. Option B, only when a new resident is admitted. Option C, whenever they are soiled, wrinkled, or damp. Option D, every morning regardless of condition. The correct answer is option C, whenever they are soiled, wrinkled, or damp. Question 17. The ability to think logically and quickly is called option A, intelligence. Option B, cognition. Option C, memory. Option D, intuition. The correct answer is option B, cognition. Question 18. Standard precautions should be practiced. Option A, only on residents with known infections. Option B, only when blood is visible. Option C, on every single person in your care. Option D, only in the isolation ward. The correct answer is option C, on every single person in your care. Question 19. When leaving a resident's room, a nursing assistant should: option A, leave the bed in its highest position. Option B, turn off all the lights, even if the resident is reading. Option C, restock supplies and leave the call light within reach. Option D, take the resident's water pitcher with them. The correct answer is option C, restock supplies and leave the call light within reach. Question 20. For a nursing assistant, confidentiality means: option A, only telling the resident's roommates about their health. Option B, keeping private things private. Option C, sharing medical info with the NA's own family. Option D, writing about residents on social media. The correct answer is option B, keeping private things private. Question 21. What is a good way for a nursing assistant to care for a mentally ill resident? Option A, avoid talking to the resident. Option B, support the resident and his or her family and friends. Option C, correct the resident whenever they say something factually wrong. Option D, encourage the resident to stop taking their medication. The correct answer is option B, support the resident and his or her family and friends. Question 22. Which attitude is helpful when working in hospice? Option A, encourage the resident to fight the disease. Option B, Respect the resident's privacy and independence. Option C. Avoid the resident's room as much as possible. Option D. Talk loudly so the resident knows you're there. The correct answer is option B. Respect the resident's privacy and independence. Question 23. Joking with a resident's roommate about the resident's incontinence is what type of abuse? Option A. Physical abuse. Option B. Psychological abuse. Option C. Sexual abuse. Option D. Involuntary seclusion. The correct answer is option B. Psychological abuse. Question 24. If a resident with Alzheimer's disease has problems with dressing, the nursing assistant should: Option A. Choose the outfit for them to save time. Option B. Lay out clothes in the order they should be put on. Option C. Tell the resident to hurry up. Option D. Dress the resident without saying anything. The correct answer is option B. Lay out clothes in the order they should be put on. Question 25. If an activity is not listed on the care plan, what is the responsibility of a nursing assistant? Option A. Perform the activity if the resident asks. Option B. The NA should not perform the activity if it is not listed. Option C. Ask the resident's family if it is okay. Option D. Perform the activity, but do not document it. The correct answer is option B. The NA should not perform the activity if it is not listed. Question 26. To prevent falls, a nursing assistant should: Option A. Keep walkways free of clutter. Option B. Tell residents to stay in their beds. Option C. Wax the floors until they are very shiny. Option D. Keep the room lights off. The correct answer is option A. Keep walkways free of clutter. Question 27. What is the medical term for high blood pressure? Option A. Hyperglycemia. Option B. Tachycardia. Option C. Hypertension. Option D. Hypotension. The correct answer is option C. Hypertension. Question 28. Which position is a resident in if he is lying on his stomach? Option A. Supine position. Option B. Prone position. Option C. Lateral position. Option D. Fowler's position. The correct answer is option B. Prone position. Question 29. Before helping a resident eat, how should the nursing assistant position the resident? Option A. Lying flat on their back. Option B. Lying on their side. Option C. Sitting as upright as possible. Option D. In a semi-reclined position. The correct answer is option C. Sitting as upright as possible. Question 30. What should a nursing assistant do each time a patient is repositioned? Option A. Give the resident a snack. Option B. Check the resident's skin. Option C. Change the resident's clothing. Option D. Perform a full bed bath. The correct answer is option B. Check the resident's skin. Question 31. What should a nursing assistant observe and report regarding the musculoskeletal system? Option A. The resident's favorite type of exercise. Option B. White, shiny, red, or warm areas over a joint. Option C. The color of the resident's clothing. Option D. The resident's ability to remember their name. The correct answer is option B. White, shiny, red, or warm areas over a joint. Question 32. The first sign of skin breakdown is: Option A. A deep, open sore. Option B. Pale, white, reddened, or purple skin. Option C. Bleeding from the site. Option D. A visible bone. The correct answer is option B. Pale, white, reddened, or purple skin. Question 33. Which of the following healthcare settings is for people who have approximately 6 months or less to live? Option A, long-term care facility. Option B, acute care hospital. Option C, hospice. Option D, assisted living. The correct answer is option C, hospice. Question 34. Which of the following statements is true of pain? Option A, everyone feels pain the same way. Option B, pain is a different experience for each person. Option C, if a resident doesn't complain, they aren't in pain. Option D, older people don't feel pain as much as younger people. The correct answer is option B, pain is a different experience for each person. Question 35. What member of the care team helps a resident learn to use adaptive devices for eating or dressing? Option A, speech-language pathologist. Option B, occupational therapist. Option C, registered dietitian. Option D, activities director. The correct answer is option B, occupational therapist. Question 36. Pressure sores can lead to option A, improved skin elasticity. Option B, life-threatening infections. Option C, better circulation. Option D, faster wound healing. The correct answer is option B, life-threatening infections. Question 37. Providing privacy while giving care is a patient's option A, professional courtesy. Option B, legal right. Option C, optional choice. Option D, facility preference. The correct answer is option B, legal right. Question 38. How should a resident with chronic obstructive pulmonary disease COPD be positioned? Option A, lying flat on their back. Option B, sitting upright. Option C, lying on their stomach. Option D, lying with feet elevated higher than the head. The correct answer is option B, sitting upright. Question 39. When communicating with a visually impaired resident, the nursing assistant should, option A, speak as loudly as possible. Option B, avoid talking so the resident isn't confused. Option C, tell the resident what the NA is doing while providing care. Option D, move the furniture around frequently. The correct answer is option C, tell the resident what the NA is doing while providing care. Question 40. The single most important thing you can do to prevent the spread of disease is to option A, wear a mask at all times. Option B, wash your hands. Option C, keep the facility windows closed. Option D, use a lot of perfume. The correct answer is option B, wash your hands. Question 41. What is one important reason why the bed should remain wrinkle-free? Option A, to keep the room looking tidy. Option B, to prevent the resident from rolling out. Option C, to help keep the skin healthy and prevent pressure sores. Option D, to make it easier for the nurse to change the linens. The correct answer is option C, to help keep the skin healthy and prevent pressure sores. Question 42. During a seizure, a nursing assistant should, option A, put something in the resident's mouth to prevent tongue biting. Option B, restrain the resident's movements. Option C, keep the resident safe and protect their head. Option D, run out of the room to find help. The correct answer is option C, keep the residents safe and protect their head. Question 43. With whom may a nursing assistant share a resident's medical information? Option A, the resident's best friend. Option B, other staff members involved in the resident's care. Option C, the NA's own family. Option D, anyone who asks. The correct answer is option B, other staff members involved in the resident's care. Question 44. Which of the following is used when documenting the amount of fluid a resident drinks? Option A, ounces. Option B, pounds. Option C, milliliters. Option D, grams. The correct answer is option C, milliliters. Question 45. What does palliative care involve? Option A, aggressive treatment to cure disease. Option B, pain relief and comfort. Option C, physical therapy to restore walking. Option D, assisting with financial and legal planning. The correct answer is option B, pain relief and comfort. Question 46. What is the correct conversion of 4:10 p.m. to military time? Option A, 0410 hours. Option B, 1410 hours. Option C, 1610 hours. Option D, 2010 hours. The correct answer is option C, 1610 hours. Question 47. To treat a minor burn, a nursing assistant should, option A, apply butter or oil to the area. Option B, use cool, clean water. Option C, apply a tight bandage. Option D, use ice cubes directly on the skin. The correct answer is option B, use cool, clean water. Question 48. What is an example of a normal change of aging? Option A, inability to think clearly. Option B, weaker muscles. Option C, constant pain. Option D, complete loss of vision. The correct answer is option B, weaker muscles. Question 49. Where should the call light be placed when a nursing assistant leaves a resident's room? Option A, on the overbed table across the room. Option B, within the resident's reach. Option C, in the bathroom. Option D, attached to the doorway. The correct answer is option B, within the resident's reach. Question 50. Which type of urine specimen does not include the first and last urine in the sample? Option A, routine urine specimen. Option B, clean catch, midstream. Option C, 24-hour urine specimen. Option D, catheterized specimen. The correct answer is option B, clean catch, midstream. Question 51. Standing with the legs shoulder-width apart is an example of using option A, low center of gravity. Option B, good body mechanics. Option C, mechanical advantage. Option D, isometric exercise. The correct answer is option B, good body mechanics. Question 52. What is a guideline for good skin care? Option A, apply alcohol to dry areas. Option B, rub reddened areas vigorously. Option C, check the resident's skin daily and report changes. Option D, bathe the resident in hot water daily. The correct answer is option C, check the resident's skin daily and report changes. Question 53. In order to communicate with a resident who is hearing impaired, the NA should, option A, shout in the resident's ear. Option B, face the resident directly when speaking. Option C, avoid using any hand gestures. Option D, speak to the resident from behind. The correct answer is option B, face the resident directly when speaking. Question 54. Which member of the care team diagnoses disease and prescribes treatment? Option A, nurse assistant. Option B, physician MD. Option C, physical therapist. Option D, social worker. The correct answer is option B, physician MD. Question 55. A resident's protected health information PHI may be shared with option A, any employee of the facility. Option B, only those who need the information for care or processing records. Option C, the resident's neighbors. Option D, the NA's own friends. The correct answer is option B, only those who need the information for care or processing records. Question 56. Why should an NA be concerned if they notice a resident's skin has become pale, white, or reddened? Option A, it means the resident is getting too much sleep. Option B, it could be the beginning of a pressure sore. Option C, it indicates the resident is about to have a seizure. Option D, it shows the resident is finally getting enough water. The correct answer is option B, it could be the beginning of a pressure sore. Question 57. When speaking with residents, nursing assistants should, option A, use complex medical jargon. Option B, use simple, non-medical terms. Option C, talk to them like they are children. Option D, avoid eye contact. The correct answer is option B, use simple, non-medical terms. Question 58. HIV can be transmitted. Option A, by hugging an infected person. Option B, to a fetus by an infected mother. Option C, through the air when someone coughs. Option D, by sharing a water glass. The correct answer is option B, to a fetus by an infected mother. Question 59. What is the correct conversion of 1900 hours to standard time? Option A, 7:00 a.m. Option B, 9:00 a.m. Option C, 7:00 p.m. Option D, 9:00 p.m. The correct answer is option C, 7:00 p.m. Question 60. When encountering a fire, a nursing assistant should first, option A, call the fire department. Option B, extinguish the fire. Option C, remove the resident from danger. Option D, close all the windows. The correct answer is option C, remove the resident from danger. Question 61. When assisting a patient with dentures, a nursing assistant should, option A, clean them in hot water. Option B, store them in the resident's drawer without a container. Option C, store them in a labeled denture cup with cool water. Option D, tell the resident to sleep with them in. The correct answer is option C, store them in a labeled denture cup with cool water. Question 62. To convert 4 ounces of water to milliliters ml, the nursing assistant should multiply 4 by, option A, 10, option B, 30, option C, 50, option D, 100. The correct answer is option B, 30. Question 63. What is an overbed table primarily used for? Option A, storage of soiled linens. Option B, placement of meals. Option C, a seat for visitors. Option D, a place for the NA to write reports. The correct answer is option B, placement of meals. Question 64. How many rubber-tipped feet does a quad cane have? Option A, 1. Option B, 3. Option C, 3. Option D, 4. The correct answer is option D, 4. Question 65. If a nursing assistant sees a letter for the resident at the front desk, she should, option A, open it for the resident. Option B, take the letter to the resident's room unopened. Option C, read the letter to other staff members. Option D, leave it at the desk. The correct answer is option B, take the letter to the resident's room unopened. Question 66. A way to prevent aspiration during oral care of unconscious residents includes, option A, using plenty of toothpaste and water. Option B, positioning the resident on their back. Option C, using as little liquid as possible. Option D, giving the resident a glass of water to rinse. The correct answer is option C, using as little liquid as possible. Question 67. What is considered a normal range for an adult's blood pressure? Option A, 150/95. Option B, 119/75. Option C, 90/50. Option D, 140/90. The correct answer is option B, 119/75. Question 68. If a resident with Alzheimer's disease shows violent behavior, the nursing assistant should: Option A, hit the resident back. Option B, restrain the resident immediately. Option C, remove triggers that may be causing the behavior. Option D, argue with the resident. The correct answer is option C, remove triggers that may be causing the behavior. Question 69. What is an example of physical abuse? Option A, ignoring a resident's call light. Option B, pinching a resident. Option C, telling a resident they are stupid. Option D, stealing a resident's money. The correct answer is option B, pinching a resident. Question 70. Diabetes can lead to which of the following complications? Option A, stronger eyesight. Option B, impaired wound healing. Option C, increased energy levels. Option D, improved circulation to the feet. The correct answer is option B, impaired wound healing. Question 71. Which kind of care helps restore a resident to the highest level of functioning possible? Option A, hospice care. Option B, palliative care. Option C, rehabilitation. Option D, acute care. The correct answer is option C, rehabilitation. Question 72. The artificial opening in the abdomen of a resident with an ostomy is called A. Option A, stoma. Option B, suture. Option C, incision. Option D, valve. The correct answer is option A, stoma. Question 73. Nursing assistants do not usually perform procedures that require: Option A, clean technique. Option B, standard precautions. Option C, sterile technique. Option D, protective equipment. The correct answer is option C, sterile technique. Question 74. Where should the nursing assistant stand when helping a resident who is recovering from a stroke to walk? Option A, on the resident's stronger side. Option B, on the resident's weaker side. Option C, in front of the resident. Option D, behind the resident. The correct answer is option B, on the resident's weaker side. Question 75. When should a nursing assistant identify a resident? Option A, after the resident has finished eating. Option B, before helping with feeding. Option C, only when the nurse is watching. Option D, once a week. The correct answer is option B, before helping with feeding. Question 76. Restraints can be applied. Option A, whenever a resident is being difficult. Option B, only with the doctor's orders. Option C, if the NA thinks the resident might fall. Option D, to prevent a resident from leaving the facility. The correct answer is option B, only with the doctor's orders. Question 77. Which sense is usually last to leave the body when a person is dying? Option A, touch. Option B, smell. Option C, taste. Option D, hearing. The correct answer is option D, hearing. Question 78. What is a factor that may influence a resident's food preference? Option A, the NA's favorite food. Option B, religion. Option C, the time the NA's shift ends. Option D, the weather outside. The correct answer is option B, Rolade. Question 79. When using a transfer belt, the NA should, option A, place it underneath the resident's clothing. Option B, place it over the resident's clothing. Option C, tighten it until the resident cannot breathe. Option D, use it only for residents who can walk perfectly. The correct answer is option B, place it over the resident's clothing. Question 80. A blank is the permanent and painful stiffening of a joint and muscle. Option A, sprain. Option B, contracture. Option C, fracture. Option D, dislocation. The correct answer is option B, contracture. Question 81. When observing catheters, a nursing assistant should be sure that option A, the bag is hanging on the bed rail. Option B, the drainage bag is kept lower than hips or bladder. Option C, the tubing has many loops to catch the urine. Option D, the bag is touching the floor. The correct answer is option B, the drainage bag is kept lower than the hips or bladder. Question 82. When providing perineal care for a female resident, the nursing assistant should, option A, wipe from back to front. Option B, wipe from front to back. Option C, wipe in a circular motion. Option D, use the same area of the washcloth for every wipe. The correct answer is option B, wipe from front to back. Question 83. What is a good way for a nursing assistant to respond to inappropriate sexual behavior by a resident? Option A, scold the resident in front of others. Option B, ignore the behavior and walk away. Option C, take the resident to a private area. Option D, call the resident's family to complain. The correct answer is option C, take the resident to a private area. Question 84. Which is the most essential nutrient for life? Option A, carbohydrates. Option B, protein. Option C, water. Option D, vitamins. The correct answer is option C, water. Question 85. What is a type of advance directive? Option A, a birth certificate. Option B, durable power of attorney for health care. Option C, a resident's social security card. Option D, an employee handbook. The correct answer is option B, durable power of attorney for health care. Question 86. What thermometer is used to take a temperature from the ear? Option A, oral thermometer. Option B, axillary thermometer. Option C, tympanic thermometer. Option D, rectal thermometer. The correct answer is option C, tympanic thermometer. Question 87. Exercises that put each joint through its full arc of motion are called option A, aerobics. Option B, range of motion. Option C, weightlifting. Option D, cardiovascular training. The correct answer is option B, range of motion. Question 88. What is an example of a common cliché that should be avoided when communicating? Option A, I understand how you feel. Option B, it will all work out in the end. Option C, can you tell me more about that? Option D, I will be back in 10 minutes. The correct answer is option B, it will all work out in the end. Question 89. What is a function of the nervous system? Option A, provides a framework for the body. Option B, senses and interprets information from outside the body. Option C, pumps blood to the various parts of the body. Option D, removes waste from the blood. The correct answer is option B, senses and interprets information from outside the body. Question 90. What should a nursing assistant do if she suspects a resident is being abused? Option A. Wait for more evidence before acting. Option B. Ask the resident if they are being abused. Option C. Report it to the nurse immediately. Option D. Call the police herself before telling the nurse. The correct answer is option C. Report it to the nurse immediately. Question 91. Which is true about nursing assistants and catheters? Option A. NAs insert the catheters. Option B. NAs irrigate the catheters. Option C. NAs observe and report regarding the catheter and drainage. Option D. NAs decide when the catheter should be removed. The correct answer is option C. NAs observe and report regarding the catheter and drainage. Question 92. Which of the following abbreviations means nothing by mouth? Option A. NM. Option B. NBO. Option C. them. Option D. The correct answer is option B. NBO. Question 93. Passive range of motion prom exercises are done. Option A. By the resident without any help. Option B. When a resident cannot move on her own. Option C. Only once a week. Option D. Only after the resident has been discharged. The correct answer is option B. When a resident cannot move on her own. Question 94. What can nursing assistants do in regards to Roman 4? Option A. Start the Roman 4 line. Option B. Adjust the flow rate of the Roman 4. Option C. Observe the Roman 4 site for problems and report them. Option D. Change the Roman 4 fluid bag when it is empty. The correct answer is option C. Observe the Roman 4 site for problems and report them. Question 95. Incontinence may be caused by option A. Eating too much fiber. Option B. Nervous system diseases. Option C. Lack of exercise. Option D. Drinking too much water. The correct answer is option B. Nervous system diseases. Question 96. If a resident starts to fall, the best thing a nursing assistant can do is to option A. Try to catch the resident in her arms. Option B. Widen her stance and bring the resident's body close to her. Option C. Run and get a wheelchair. Option D. Tell the resident to stand up straight. The correct answer is option B. Widen her stance and bring the resident's body close to her. Question 97. Insulin reaction hypoglycemia can be caused by option A. Too much food. Option B. Too little food. Option C. Lack of exercise. Option B. High blood pressure. The correct answer is option B. Too little food. Question 98. Which of the following is true of transmission-based precautions? Option A. They are used instead of standard precautions. Option B. They are practiced in addition to standard precautions. Option C. They are only used for the elderly. Option D. They are used only when the NA feels like it. The correct answer is option B. They are practiced in addition to standard precautions. Question 99. Which temperature site is generally considered to be the most accurate? Option A. Option B. Axillary armpit. Option C. Rectal. Option D. Tympanic ear. The correct answer is option C. Rectal. Question 100. 10 ounces is equal to blank milliliters ml. Option A. 30. Option B. 100. Option C. 300. Option D. 500. The correct answer is option C. 300.